I strongly advise that we think about how we can improve people's health rather than reorganizing the National Health Service on a regular basis.
Now, regular listeners will know that Tuesdays means the Leaders Panel. William Hague, former Conservative leader, is limbering up. Kezia Dugdale is away, but Joan Bakewell is here.
They're both doing their calisthenics as we speak. It will ask if only ex-politicians can fix the NHS, find out if the banks have made their lives difficult, and if councils should be allowed to boycott Israeli products. Sajid Javid has a very direct message for the NHS this morning. He says the health service needs fundamental change because it's making us sicker, and calls for a royal commission that will bring some direction to that change. We spoke to him earlier today about how a commission would actually help.
When the NHS is discussed in Westminster, it does very quickly turn into this political football. I mean, that is obvious for anyone to see, and it stifles any serious conversation about its future and about how to make improvements. And in our country, in the past, when we've been in that kind of situation, something that is so important as this clearly is, that the whole purpose of royal commissions is that it is to have this sort of body that is taken away from day-to-day politics to report back. And ultimately, remember, whatever the Royal Commission comes up with, it's for the government of the day to decide. That's the democratic and the right approach. And other than that, I certainly can't think of another way to look at the NHS for the long term and make sure it's fit for the next 75 years.
Okay. I am really interested in, and I thought it was very striking that you said that privately Labour and the Conservatives concede that the NHS is unsustainable as it is currently run. And we've spoken to people on both sides today, and they both said that's not true. But maybe that goes to the point. That's just a point that you've made.
That's the point I'm making. That's exactly what you'll get today, right? You'll get any.
So are they fibbing? Are they fibbing, Sajid Javid?
Well, they're saying what they think the people want to hear, right? What they're saying is, I told you, there's a narrative of adulation, and they think that people just want to hear that everything's great, don't worry about it, isn't it all brilliant? When the reality is, what matters, I think, to people are health outcomes.
Sajid Javid there talking to Asma earlier. William Hague, serving politicians are cowards. What do you think?
Well, I'm not sure. I'm not going to accuse them all of that. Of course, it is difficult for them on the National Health Service because Sajid's quite right. You do get drawn immediately into a party political debate. No party is going to give any credit to the other in an election campaign on something as important as the National Health Service. But they have to be realistic about public opinion. I think that we could achieve huge improvements in healthcare in this country, but I'm not so enamored of the idea of a royal commission. That can be a way of spending years looking at a problem, while putting it to one side. And then at the end of it all, as Sajid was just pointing out, it's up to a future government whether to do it, and they might not do it. So you can waste an awful lot of time. Whereas if we actually had something I've been going on about, a food strategy in this country, and if we actually use technology effectively in the National Health Service, than we're doing at the moment, well, then we could make huge improvements before having a royal commission or without having a major reorganization of the health service, which always is expensive and time consuming.
So you don't actually think the first principle here, the NHS is unsustainable and needs radical reform, you would actually say it's the public health policy around the NHS that needs radical reform?
Yeah, I think healthcare in this country is unsustainable in its current form, but not necessarily the National Health Service. If we had much more effective policies to tackle obesity and diabetes, well, then it might be sustainable in the health service. And there were some important announcements from the Prime Minister last week on the long-term workforce plan for the National Health Service, which is trying to make it sustainable for the future. So yeah, I think I have great respect for Sajid. I think he's one of the most thoughtful people who've been in politics in recent years. But I'm not sure a royal commission is the answer, although the health service is unsustainable. It's healthcare, it's the public health of the population, which can't be, which is on an unsustainable track at the moment.
Joan, first principles.
I would roll social care into that as well, because social care is really the end game of the national health policy. It's how you address the last years of your life and how you're cared for as you move towards your death. Now, that also should be part of a look at life's promises that the government can make and can deliver, and it should be ruthlessly analysed to see how it should be organised. I think it does need reform, but there is, of course, a great pressure. Hundreds and hundreds of private companies eager to have a slice of the National Health Service. So they are putting enormous pressure on the government to privatise it, to share it out between all the profit-making companies, who are often very efficient, and many of them are already in use. But they are a force who want the National Health Service to move in one direction. We need to jack up the forces defending it to keep it where it is.
But why do you want to keep it where it is? Because it doesn't work.
Well, I think it needs, where it is, I mean by not being a national institution. I do think it needs reforming, but I don't think the answer is to share it out between lots of little private companies.
What about the argument that in other civilized, often socialist countries, Joan, they have systems for which their health service is paid, which is not free at the point of use. They have insurance systems. You look at places like Denmark, you look at places like the Netherlands, Germany, where you have better health outcomes, but they don't have this national institution. And actually, it does better than that. Is it heresy to even consider those other models?
No, I know, and I've examined those different health services, and there's something to be learned from each of them, of course. I mean, you must always learn from people who are doing it better than you. So I'm not at all resolute in, hold the door where it is and don't let any change come in. I'm all for change that improves things. But to actually dismantle something that's called the National Health Service, which commands the respect and enthusiasm of a majority of people in this country, they only wish it was working more efficiently. That would be a reckless move to make. So I think a lot of attention has to be paid in how we improve it. But there are many options to listen to, and the people might be one of the options.
And that's certainly true. But just finally on this point, Joan, could that work, in your view, ever be a system that is not free at the point of care, in the sense that people who are in jobs pay through their insurance, which happens in lots of other countries? It's still a universal health service, but it's not free at the point of use. It's predominantly insurance supported. Is that something that to you is anathema, or is something that needs to be looked at?
Well, I mean, I do think we do pay for it all, of course, already through our taxes.
Yeah, exactly.
I mean, there's no such thing as absolutely free. We pay our taxes into a pot, and the government distributes those taxes to support issues and enterprises that we approve of. And at the moment, the public approves of something called the National Health Service. And it would be folly to dismantle that public preference simply in the interest of trying to make it more profitable, according to the dictates of people who haven't ever tried it out.
Yeah. Will this change ever in our lifetime? Do you think that actually we'll be talking about this in 10 years' time, in 20 years' time, same way, same system?
I think we will. By the way, I don't think anybody's proposing dismantling it or anything that Joan was just suggesting. There's just been a huge announcement of additional government investment in recruiting more doctors and nurses for the National Health Service. But we will be talking about it in 10 years' time, I think, because of what I mentioned earlier. Public health is on a bad trajectory overall. New health treatments will become available, which will be a very good thing, but many of them will be very expensive. And so this will continue to be an extremely difficult political and social issue, I think, more or less forever in the future. But I strongly advise that we think about how we can improve people's health rather than reorganizing the National Health Service on a regular basis, because we've done that a lot and it doesn't always lead to improvements.
That's a really interesting way of putting it. I just want to, before we move on this subject, we read out a story, an email from Dale earlier about how his wife, who works in the NHS, saved the life of their neighbour because they were bleeding out. The ambulance couldn't come, so they put them in the back of their estate and saved their lives. He's just sent another email saying, with my daughter in the back holding our neighbour's head and my wife holding his leg up in the back of our Land Rover, which I did not know would do 90, I called 999 again, So the ambulance didn't come the first time, so he called 999 again to warn the hospital of our arrival, only to have to go through a list of personal details. Then they couldn't understand the name of our local hospital, finally to tell me they had no link to our hospital to warn them of our impending arrival. You couldn't make it up. We're talking about AI revolutionising the NHS. We have interconnecting phone systems, but apparently not in the NHS.
Goodness me. Now, let's move on and talk about bank accounts, because some politicians are having trouble with them. The Treasury has been saying that overzealous checks on politicians are leading to the banks closing accounts without proper reason. Last week, Nigel Farage said his bank accounts had been closed because of his political views. But we spoke to Ed Vaizey, Times Radio presenter and former Conservative minister, about his own experience. He's generally known for his quite centrist views.
These politically exposed persons' guidelines are implemented by the banks in the most Kafkaesque manner. I bank with a high street bank out of the blue, having banked with them for 15 years. I got a 10-page form asking me all my detailed financial details, including things like what were my casino winnings. But to add insult to injury, my 85-year-old mother, who banks with the same bank, got the same form with an officious letter saying if she didn't reply within 14 days, her account would be closed. I've had my credit card taken away by another credit card provider because they wanted ridiculous details about my finances. My son, when he turned 16, big moment, wanted to get him a bank account, couldn't get one because he was a politically exposed person at the age of 16. We've had numerous meetings with Treasury ministers. We've had, this is members of the House of Lords because it affects lots of people. Meetings with the FCA, the Financial Conduct Authority. They promised a review. Absolutely nothing will be done about this ludicrous. The regulation itself may not be ludicrous, but the way it's implemented is ludicrous. A child of 5 could understand the regulations. They say that PEPs carry a higher risk. British PEPs carry a very, very low risk. The families of British PEPs carry the lowest risk possible. Every case must be treated on its merits on a case-by-case basis, and no one can be refused banking services on the basis that they're a PEP. Anyone can understand those regulations. The banks simply just refuse to implement them, and they find it much easier just to deny banking services to PEPs, and it's pathetic.
That was Ed Vaizey, very strong views on that, PEPs, politically exposed people. Joan Bakewell, Ed Vaizey says this is something that's been going on for quite some time. We've been talking about it for 10 years, apparently, but no one's really paid much attention to it until Nigel Farage brought attention to it. Is it something that you are aware of? Have you heard other people complaining about it?
No, I feel completely sidelined here. I'm not part of the great banking scandal. So I'm just jogging on with my usual bank, and I've heard nothing from them. What's going on and why? I mean, why are the banks suddenly checking out? Are they fearful? This is what often prompts people to act. Are they fearful they caught a whisper of some legal procedure that might be taken against them, or some legal loophole that they've suddenly become aware of? I'm suspicious of that kind of explanation, because that's what motivates a lot of people to kind of tighten the system so that they're foolproof.
William, first of all, then, is this something you were aware of? Have you ever had a form that's demanded all sorts of information and you've decided not to fill it out?
No, I haven't. Nobody's ever asked me about my casino winnings. It was a very small amount if they did ask that. No, I am aware of these regulations, and that banks make additional checks on people like me, politically exposed persons. I was Foreign Secretary, so very politically exposed. But I've never had any difficulty over that. I'm very concerned to hear, though, about what Ed Vaizey describes and what's happened to Nigel Farage, because these checks are meant to be one line of defense in making sure that there isn't corruption going on in our political system. But they're absolutely not meant to stop people having access to banking services, and particularly not to stop their families having access to banking services. So I think this is something where banks are going to have to put their heads together and have a consistent policy and be clear what the purpose of the policy is, because yes, I've not experienced any difficulties, but it's clearly going wrong here somewhere.
And do you think that the other strand, of course, this is that Nigel Farage said that he felt his bank account had been closed because of his political views, but you know what's happened to Ed Vaizey would suggest that that's not. It can't really well, might not be the case.
Yeah, it does suggest that. And we, of course, we don't know. And banks, quite properly, will stay completely confidential about any decision they've made about individuals. So we don't really know why what's happened to Nigel Farage has happened. It certainly should not be because of political views, but it also should not be because of the sort of excessive zeal that Ed Vaizey was just describing. So it's it can't be allowed to continue. People should be allowed to access banking services, whatever their political views, even if they are checked up on a bit more than the average person, which is really what all of this is meant to be about.
Yes.
The government has been urged to rethink plans to fine public bodies which try to boycott Israel. It says a new bill aims to prevent local councils from pursuing their own foreign policy agendas. But it faces criticism by both Labour and Conservative MPs who are concerned about the impact on free speech and the UK's wider foreign policy. This all comes amid Israel's latest military operation we've been discussing today in the occupied West Bank. The former Labour Minister Margaret Hodge has long campaigned against anti-Semitism, but she explained her opposition to the bill on Times Radio.
The local authority members are elected. There is no difference between a backbench councillor. They have as much legitimacy as a cabinet minister. They both go to the ballot box. They both get elected. And the idea that elected politicians at the local level should be denied the right to give expression to political views that bring them into politics is a terrible, terrible way to go, particularly because in this particular bill, there is a clause in it which says not only are they not allowed to do boycotts, and Israel is the only country mentioned, no other country is mentioned.
Joan Bakewell, Israel is a political entity. It is occupying territory which the international community has said is illegal in the way it has done, and it has, on record, killed innocent people in its quest for its own security. It is there to be criticised as a political entity. Is it a free speech issue to say that some public bodies, if they're so mandated, should be allowed to boycott the country?
Well, if they're mandated, now that means that there's a universal support for what they're doing, but nothing is an absolute majority. And it's very difficult to disenfranchise the people who did not vote for your boycott. So that if you have a membership and 30% don't support a boycott, you can't ignore them. You can't ignore them. I think boycotts have to be left to individuals, and perfectly legitimate for individuals to boycott whoever they want. But the institutions have got a different problem because they have a constitution which makes them answerable to their members in full. And that leads to lots of problems, possible legal appeals, all sorts of confusion.
And presumably also there's this question of whether a boycott of a local council, it won't have any meaningful impact for change, will it? So does that feed into the equation at all?
Well, it could be cumulative. I mean, if a lot of local councils started boycotting, I mean, Israel would have to notice, particularly if there were products coming that way and they were importing and distributing and so on. So I think it's not just one council, is it? The idea of many councils boycotting, which might be the message that's spread. I think one can make one's disapproval known in different ways. There are different avenues for doing that, political parties being the main one. But also you can exercise your own choice and decide that you yourself will not buy the products of a particular country.
William, is it ever acceptable for a public body to boycott Israel, in your view?
Well, I don't think it's acceptable for local councils to have their own foreign policy. And so that would include public bodies, local councils, deciding they're boycotting, divesting in a way that's different from the UK government policy. This all started in the 1980s with councils declaring themselves nuclear-free zones, as if in the Cold War they would be missed out by the Soviets if there was a nuclear war. And there's a ridiculous aspect to it. But it should apply equally to all countries. I thought, while I didn't agree with everything Margaret Hodge was just saying in the clip you played, because cabinet ministers don't have that, the local councils don't have the same rights as cabinet ministers. Cabinet ministers don't decide on planning permission. in a local authority area. Local councillors shouldn't be deciding on foreign policy issues. It's not the same. But she did say that Israel's the only country mentioned on the face of the bill. Well, this should be a general law if it's going to be a law, not directed at a particular country. And so I think the government will have to listen to some of the criticism and look at amendments to the bill.
Finally, we're going to talk about cricket. There's been an international row over the cricket this weekend. The Australian Prime Minister, Anthony Albanese, replied to the chant of same old Aussies always cheating by tweeting, same old Aussies always winning, and said he was proud of both his men's and women's Ashes sides. Now, of course, we want to just kind of dampen this down now. We don't want to continue this anymore. So Stig asked Johnny Mercer what his own position was on this entire ordeal.
I think we should consider ourselves lucky. These guys were caught sandpapering the ball 3 years ago. So I think fair play out of these guys is not something you're going to expect. And let's get on with it and give them a good pasting in the next test.
Well, there we go. Joan Bakewell, is the cricket route a win-win for politicians on both sides? They can be very populist.
Well, I follow it keenly, and I had to examine the rules of cricket before I understood why there was such a furore. But I found it very interesting. Television coverage is brilliant. The close-up of the wickets and the direction of the ball and the spin on the ball, fascinating. I love all that. So an issue like this binds me even more strongly to the coverage to find out what's going on. Games are competitive. People like to win. They aren't the smooth international goodwill enterprise that we would wish. They are extremely well fought. People mind. They get angry. They shout. They throw down their bats in fury. So I enjoy all that. I think that's what games are. They're not gentle exercises in humanity and goodwill. They are competitive, cruel enterprises.
Yeah, absolutely, as they should be. William Hague, what Rishi Sunak has said that it wasn't cool, it wasn't within the kind of the spirit. What do you think?
Well, I think that's right, but I would have said that as Prime Minister, but I would also say what the Australian Prime Minister said as Prime Minister. You know, what are they going to say? Of course, but now I think, you know, with my former diplomatic hat on, I think that is enough. I'm on the side of that's enough. So that will be very exciting.
That's enough.
But remember, it is a game. I'm going to get into trouble here of my own, but it is a game, and this is one of the countries that we're most friendly with in the entire world. So, you know, very unfortunate. Everybody should remember the phrase, whether something is cricket or not. But, you know, that's enough now. Let's move on to the next thing.
Okay, but before we move on, can I just ask you, what did you make of those scenes inside Lord's? The booing and the hissing that went.
I don't like that either. No, also English fans have to remember what's cricket and what's not cricket. And that's all pretty unsavory. So if it's meant to be such a nice gentlemanly game, the crowds as well as the players have got to remember that on both sides. He hates to add.
You take the politics, you take about the politics, but you can't take the politics out of the man. Joan, I don't know how political you want to be here. You tweeted this morning saying that you'll be the publicity says you'll be judging Portrait Artist of the Year. Alas, no, sadly, I've been dropped. Why on earth have you been dropped, Joan?
I've been overwhelmed by tweets. It's not the case in the immediate future. It's in the long term when the next year comes round. I am in the current recording. It will go out with me there in the flesh, as it were.
But why have you been dropped for the future, Joan? Do we need to campaign to get you back?
Yeah,
I think all programs change. Presenters get older. I've got older than most, so I've survived quite a long time. But you'd have to ask the producers about that. I don't know.
But do you want to do it?
Look, I'm still fit. I live on my own. I enjoy working with colleagues in enterprises which bring me satisfaction. So why should I not want to go on doing anything that rewards me in that way?
Well, we love having you on this programme. Yeah. They've not said to you that it's because of age, have they, Joan?
Thank you for
No,
that.
they've not said to you it's because of age. They've not said you're too old to do it.
No, I don't think anyone would dare say that. I don't think. I think it's probably against the law. No, they haven't. We just. It's an awkward moment because I've jumped the gun and made a prediction about my future, which has brought a cascade of comments and so on. So I'm in the middle of sorting that out. So can we let it lie for the time?
Okay, enough said. Bring back Joan. Bring back Joan. Yeah. The cry will go up. Well, I had to ask you about it because you did tweet about it this morning, Joan. Really interesting. Well, I'm sure look forward to seeing you on this season at least.
That was William Hague and Joan Bakewell. And if you like that kind of panel format at 7 o'clock, Monday to Thursday in the evening, John Pienaar goes through the big stories of the day with two guests as well.